Is your doctor silently denying you essential treatment? The question is your doctor silently denying you the essential treatment you desperately need without you even realizing it? And more importantly, what can you do to ensure that you won't end up on dialysis just because your insurance decided so? The treatment denied to Catherine. What I want to share with you today are 7 essential treatments, medications, and tests that you are likely being denied right now. We live in an era where a patient challenging a denied request can be arrested just for saying the wrong word in a phone call. Yes, this has actually happened. Unlike healthcare systems in other countries, here's an interesting fact about the U.S. United Health Group, the largest health insurance company in the country, has reportedly denied over 30% of claims. Most people only read about these things in books. Let that sink in, over 30%. How can a CKD patient survive if they're only receiving a fraction of the care they truly need? Let's face it, it's even harder for patients when 30% of their treatments are denied. Of course, this is a very serious issue. If 30% of your treatments are rejected, you should already be familiar with the struggle. There are 7 critical interventions that most CKD patients are being denied. Let's go through them and start with the simple steps you can actually take to fix this yourself. Number 7. Prescription supplements. Prescription supplements. There are certain supplements that your doctor is supposed to prescribe based on specific health indicators, but do they actually do it? Let's start with sodium bicarbonate. Even though sodium bicarbonate is used to clean sinks and similar things and only costs a few cents, many patients don't get prescribed it. I guess every penny counts when your industry makes $215 billion a year from our pockets. Sodium bicarbonate is easy to use and safe. To properly use this supplement, you need to have your serum bicarbonate or CO2 levels tested. Every CKD patient is required to take this test at least once a year if they are in stage 3, and even more frequently in later stages. Conducting these tests is the most expensive part, and you can be sure they cut costs whenever possible. It becomes much harder for them to deny you a test when you ask your doctor directly. Once you get the test, check your lab report. If the number is below 23, talk to your doctor about it. In clinical practice, the correct starting dose should be calculated based on your CO2 or serum bicarbonate level and your body weight. The costly part of using sodium bicarbonate isn't the bicarbonate itself, it's paying a nephrologist to calculate and tell you the exact amount you need. So why not just do these calculations for everyone and share them here? Now, this is only for emergency situations, if you can't get an appointment with a nephrologist or if they simply don't care whether you live or die. At least now you'll know how much bicarbonate you might need. You'll see your initial CO2 or serum bicarbonate level on the left, your body weight on the right, and the number of 650 mg sodium bicarbonate tablets you need daily. If your CO2 is 20 and you weigh 70 kilograms, you'll need about 6 tablets of 650 mg sodium bicarbonate to start. Then, your CO2 should be monitored, and your doctor should adjust this dosage accordingly. Hopefully, this is clear enough. Feel free to ask in the comments if you need more information. Number 6. Vitamin D. This is a doctor's job, that's why we pay for insurance. But clearly, we are living in dark times when you need to start learning these things on YouTube instead of having a doctor handle them for you. Even dark times have gotten darker these days. In the past, dark times meant waiting an hour at the DMV. Now, it means your insurance company decides that your healthcare is optional. This is why you must always make sure you get sodium bicarbonate if you need it. Leaving metabolic acidosis untreated can push you from stage 3 CKD straight to stage 5 in just a few short years. Next, number 6 is the second prescription supplement that many people need, vitamin D. Now, the effects of not being prescribed vitamin D when you need it may not be as immediately catastrophic as not receiving bicarbonate, but you will still lose teeth and break bones more often. And yes, of course, low vitamin D levels can lead to depression and high blood pressure. But at least your kidneys won't be soaking in acid. Anyway, you might be wondering if taking vitamin D also requires testing and calculations, and yes, of course, it does. The goal here is to keep your 1,25-dihydroxy vitamin D levels within range, meaning above 30 nanograms per milliliter and below 100 nanograms per milliliter. To do that, you need to have these levels monitored, along with your PTH. If you want to see me make a 1-hour video filled with nothing but bad jokes about the US healthcare system, just send a letter to your insurance company with the following word, open. Please don't actually try to contact your insurance company. Remember, in America today, objecting too strongly to your insurer, even over the phone, is considered an act of terrorism and could get you arrested. Number 5. The necessary tests now, folks. Here's an interesting fact. Tests for both vitamin D and serum bicarbonate levels cost more than the supplements themselves. Yet, I've seen plenty of patients with flagged abnormal values on their lab reports, but no supplements prescribed. So, if you're an executive at United Health, here's your new cost-saving strategy. Don't conduct the tests. Deny them. And feel free to donate all the money you save to a charity of your choice, or, just do your job. Oddly enough, one thing they haven't cut for some strange reason is serum phosphate tests. Just like with vitamin D and serum bicarbonate, knowing your phosphate levels and being prescribed the right supplements or medications can actually save you from ending up on dialysis. And no, I'm not exaggerating. Not enough bicarbonate is like soaking your kidneys in acid. Not enough vitamin D makes your bones break. And too much phosphorus turns your parathyroid glands into oversized tumors. On a more serious note, it's not just prescription supplements that are being ignored. Patients are being denied their blood pressure medications, no losartan, no amlodipine, or their diabetes medications, no insulin, no metformin. This is deeply concerning. Number 4, denied a doctor's visit. Next up, number 4, what's worse than being denied a prescription that could save your kidneys? Being denied the chance to see a doctor at all. We've always known that healthcare in the US is bad, but what if it's even worse than we feared? A recent comment, it took me 3 months just to get approved for an appointment with a nephrologist. 3 months just for approval, that sounds brutal. Another comment, nephrologists schedule appointments years out until you end up on dialysis. So, if being denied treatment is already bad, imagine being denied the chance to see a doctor at all. Number 3. Unsafe prescriptions. A direct consequence of seeing a nephrologist only once in a long while is using medications that are no longer safe for your kidneys. The reason you need regular nephrology visits isn't just for new prescriptions or tests, it's also to ensure that the medications you're taking remain safe for you. This is called dose adjustment for kidney disease. As kidney disease progresses, some dosages must be reduced. This happens because certain medications are cleared by the kidneys. Metformin is great for stage 3 CKD, but once your GFR drops below 30, stage 4, it should be discontinued. Farxiga is similar. When kidney function falls below 25, it's no longer recommended. Some beta blockers, like amlodipine, also need dose adjustments when GFR is below 30 since they're excreted through the kidneys. That's yet another reason to see a nephrologist regularly. And, as we've seen, some patients are denied even that. Some of you may have noticed an inconsistency between United Healthcare reportedly denying 30% of requests and some patients receiving little to no treatment at all. But why are patients being denied all of this care? Is it just the infamous 30%, or is the situation in the US worse than it seems? From my experience with CKD patients worldwide, the situation is worse than 30%. My experience tells me that many patients could completely avoid dialysis if they simply received the right tests and treatments on time. That's a bold statement, but you have to understand, I treat patients from many countries every day, all facing the same issue, CKD. Patient A comes in the morning. He is from a European country or Canada. He has stage 4 CKD and undergoes regular testing for metabolic acidosis, vitamin D, serum phosphate, everything. He is on 6 to 10 different medications. Then, patient B comes in the evening from the US. He also has stage 4 CKD but is not tested for metabolic acidosis. He does not receive vitamin D or any phosphate binders. He is on only a few medications, and the test values he does have are unstable. This is the result of a healthcare system that denies 30% of your requests. Now imagine you are a doctor, and your goal is to build a treatment plan with only 70% of what you need. How would you construct that treatment plan? This is not hypothetical because the insurance company will deny it. You say the patient needs X. They ask, have you done a CAT scan? No, they don't need a CAT scan, they need Y. No, they need, so I have to argue for 45 minutes. I don't get paid for that. I don't know which pills or capsules the patient needs. Their insurance denies the appointment because I didn't enter the right code or something. So you try to order an MRI, and it gets denied every time. What do? You have thousands of patients and can't waste hours every time you request an MRI, so you just stop ordering MRIs. Now multiply that by the vast majority of what patients need. That's why when they say United Healthcare denies 30% of requests, that's not what I see in my practice. You would think that US patients would at least receive 70% of the care that European and Canadian patients do, right? US patients receive only a tiny fraction of the treatment they need, closer to 0 than to 70%. They will require dialysis years earlier than they should, and they will have shorter lifespans. This tells us that it would actually be cheaper to keep people healthy. But no, they don't do that because there's more profit in watching people deteriorate and then showing up at the last minute with a bill that looks like a ransom note. This means that patients are denied far more than 30% of what they need, and what's worse is that many doctors can't do anything about it, even if they want to. Number 2, denied dialysis. They have completely wrecked your treatment, not enough tests, not enough medication, you're just watching your numbers worsen at every checkup. What could be worse? How about not receiving the dialysis you need to live? This is the heartbreaking story of a young woman who was denied the most essential treatment. Her name is Anna Vioso, and she says, UHC denied my dialysis because they said I was eligible for Medicare. So, on top of my condition and all the stress my family and I have to go through, we have to pay an extra $180 a month for 2 insurance plans. Not to mention all the fights and frustration we go through. They don't care about people. Now, what makes this even worse, if that's possible, is that this woman is only 28 years old, and she never even received a diagnosis for what caused her kidney disease. Because Anna Vioso has a small YouTube channel where she shared a video called Stuck with End-Stage Kidney Disease. Why? I like to think that God gives his toughest battles to his strongest warriors. But anyway, I went from normal to dialysis without a catheter, then spent 10 days in the ICU due to infection, peritonitis, and then on to hemodialysis, which, since 2021, has been the treatment replacing my kidneys. But this is also me making peace with my condition and my body, and being grateful every day for the good things, because I always focus on the good. Now, guys, I know this is hard to think about, and I truly feel sorry for her. But all I can do is share some awareness to let people know that this is really happening. That's all for today. Thanks for watching. Wishing you all the best. Goodbye.